I like to always begin with showing the map of Appalachia because so many people don't recognize how big this territory is. It actually includes parts of 13 states. There are 420 counties in it, West Virginia being the only state that's totally all in Appalachia. Now remember, this is a political geographic region. And so that is an important factor when we talk about it, because people seem to think Appalachia is one place. But what I can tell you from experiences I've had and what I've learned over the year, if you've seen one county, you've seen one county. And in Appalachia, it's about the county that you live in. And that's what people talk about rather than referring to their hometown, because most of us wouldn't have a clue where their hometown is, and many of us wouldn't know where that county is either. And so it's really important to distinguish that. The Appalachian Regional, I know this is a little bit blurry, and I just wanted to point out that the Appalachian Regional Commission's priority areas are really on infrastructure and economic development. And there is a focus on health care, and there is a focus on education and other areas. However, those aren't the predominant perspectives that they look at. And that may or may not be fruitful for addressing some of the other problems that we see related to health, and particularly since you're talking about substance abuse. I want to talk just a little bit about the diversity in Appalachia. If you're thinking stereotype, which is what most people think when they, I am an Appalachian. I don't play the banjo. I don't sing bluegrass. My father doesn't have a still in the mountains. My mother never made quilts. And, so all of those, but I'm Appalachian. So if you live in Appalachia, you're an Appalachian. So if you live in the region, you're counted among the demographic. However, there are some cultural traits that one can identify by talking with people and being in the region to understand things better, and that really is what we need to do. First of all, it's not all mountains, all right? Because I'm now working in Mississippi, and they tell me there's hills there, but I have a hard time seeing them after coming out of Ohio, right? and I say, yeah, that's one perspective, But so it's not all mountains, and most of the time when people talk about Appalachia, they're really talking about the central region, which is largely eastern Kentucky and West Virginia. And I hate to tell you this, but Southeast Ohio has the similar demographics, that we're part of that same region. We just get lost in our state sometimes and don't realize it. In Appalachian region, there's not very much urban areas. What you see is mainly rural places. And so much of what we talk about in our educational systems and even in our policies comes out of urban thinking. And so we have some difficulties when we try to take those urban thinking ideas and put them into rural places. Things work just a wee bit different there. What we can say is that the rural regions lag behind, the rural regions in Appalachia lag behind the rural regions in other parts of the country. Right? So you might see some disparities even in that area. And there's a large difference between what we call distressed areas and non-distressed. Another important factor to remember is in the majority of Appalachian region, it's populated by Caucasian people. It's only when we get down in the southern areas that we begin to see the minorities. Many of the Southeast Ohio counties have less than 1% minorities, and probably the maximum would be about 5%. So this map shows the some of the economic distress that we can see. Right now in 2013, the Appalachian Regional Commission identified 98 different counties throughout the area that are identified as distressed. And so these would be the most economically desperate people in the country, probably. However, there's almost another 100 that are considered at risk And many times over the years, these counties have slid back and forth between distressed and at risk. And if you were to go to many of these at-risk counties, you would have a hard time seeing what the difference is. That dark blue is the what they call attainment counties, and we have 3 of those in Appalachia, right? Those are the counties that look like much of the rest of the country. And so this, again, begins to help us understand the disparities that we see in this geographic region compared to other parts of the nation. Even though there's been more than 50 years of investment and attention played here, we still have these problems. So when we look at distressed places, what do we see? We see mostly rural places. We see really poor economic factors. Many of the jobs that were there that established these communities are long gone, and the families still remain and try to pluck out a living. The population has predominantly smaller, so fewer people are living there than what they were at some earlier time in history. Little diversity. Most places don't have major highways. You can get there, right, and much easier than in the past. But I go down to Grundy, Virginia. I don't know if any of you have been to Grundy, Virginia, but it's a place that's hard to get to and hard to move around within that county because of the mountains. We see disparities in water and sewer systems still. They're there, they work, but they're different than other places. No internet. I have places I travel to where you can't use your cell phone, and you definitely can't get on the internet, and many people just are still using dial-up. And so those are things that really are putting people at risk in these areas as they live and have lesser opportunities than others. Large levels of depression and fewer high school graduates. I'm going to talk to you more. However, despite all of this, we see some really positive things in the Appalachian. It's the most beautiful place in the world, right? It's a great place to vacation, and the people that live there just get up every morning and say, oh, I wouldn't want to be anywhere else. They're thankful for that. And the communities themselves are often very vibrant, and people are very engaged. And despite the problems and generational problems, many still remain extremely optimistic and hopeful for the future. We see some agricultural opportunities and changes in some of these places, and there's definitely some opportunities for tourism and ecotourism that haven't been looked at. And I'm hearing more and more people talking about get outdoor projects. Those people that live in the cities want someplace to go, and so Appalachia is it. These are the distressed counties in the entire region. You can go on the ARC website and see and find those. These are the Ohio counties, and Athens is in the bottom quadrant, kind of in the middle there. And so some of us are from there. We wanted to make sure you knew where we were from, right? And so we have 7 counties right now in Ohio that are considered distressed, Athens being one of those. I want to give you some statistics to kind of help you see the disparities here. First of all, the per capita income. When we compare the Appalachian region with the United States, you can see there's about an $8,000 difference in the median salary. Ohio's salary is a little bit lower, and it's probably because 1/3 of the state is part of Appalachia. And when you look at the bottom number, which is Appalachian Ohio, you see that the average median income there is $21,000. So if you took Appalachian Ohio out of Ohio, Ohio would probably look better than the United States. Right? So sometimes you have to think about things when you're looking at demographics and this kind of a relationship. The poverty rates, again, the United States, 13.5. You can see through there, but Appalachian Ohio, 16%. Right? So we're higher than the Appalachian region, and definitely higher than the state of Ohio as well. Unemployment rates, the dark blue is the worst areas. Again, you can see that largely falling in the Mississippi region, the Southern Peace, and central Appalachia. So if we look at some numbers for us, we can see that United States 8.2, and this is a moving factor, right? Yesterday or the day before we had some better numbers, right? So those numbers are continually changing. But you can see that Appalachian Ohio during that time period was greater than. But one of the things that happened in Appalachia over the last 4 or 5 years is that what happened for them was not that much different, right? Things didn't change all that much because they'd already been living with that rate of poverty, that rate of unemployment, and it just sort of stayed the same. It's just the rest of the nation kind of experienced it more differently. High school completion, I put up 1990, 2000. I don't have the next map yet. But you can see that the numbers, just by looking at the colors, are not changing a whole lot and not very quickly. And so when we then look at particularly our state, our Appalachian region, you can begin to see the difference, particularly if you compare the United States, not so much with the high school, but look at the difference in the college graduates. 24.4% in the nation and 13.2% in Appalachian Ohio. So we still have many students who are first-generation college students. Not a great amount of support for higher education still in the region. I want to brag on Ohio University because we have 5 regional campuses that really have made a difference for that area and are providing opportunities for many young people that wouldn't have been there otherwise. But we still continue to see the disparity, and this is making a difference. And then many of the students who do get the college degrees can't find work there, and so they leave. All right, so that creates another problem for the area. So living in Appalachia means not much income in the family, a little difficulty in transportation. If you don't have a lot of money, you may just have one car, and then gasoline costs a lot too. And so those are problems. Limited health care access. I work in many counties that have no hospitals, and several of the ones that do are just critical access. And so those are greater concerns. Lower life expectancy, more older people, and more people with disabilities. When you can't find a good job, you take any job, and that often means injuries, uninsured, and disabilities in the end. I just made this one table so you could see a little bit about the age difference, and if you compare the U.S., 12.9% was 65 and older, with Appalachian Ohio 15.5%. You can begin to see we have more older people in our communities than we do younger people. So one could say we have a heap of hard luck where we live, and things can be rather challenging. There are very few good jobs. There are a lot of problems. People don't have much health insurance. Our kids leave. They go someplace else. We have alcohol and drug problems. We have the highest rates of cancer, strokes, heart attacks, blood pressure, asthma, and diabetes. Might be a little hard to convince people to come and visit, right? It's not catching, though, and actually there are so many good things about it. I don't work with substance abuse, but I was born in Portsmouth or Scioto County, and I live in Moorhead, Kentucky now, but I'm working out of Portsmouth and Scioto County again, so it's giving me a new refreshing affiliation with my birthplace and old colleagues that I've known for years there. And so I wanted to just use it because Scioto County is one of the worst places in the nation when it comes to drugs, substance abuse, alcohol problems, and others. And so we're continuing to see drug overdose, increasing rates of that. But with this substance abuse comes other problems, and it relates to family life and child abuse, spousal abuse, no work, lost work time, and every other kinds of thing that you can imagine. And so if you were to look at these statistics related to these things in the county, you would again see lots of disparities. So when I say a heap of bad luck, it's really bad. right? These are serious problems. More drug overdoses, more arrests, more meth labs. Meth labs is not probably the predominant problem, at least in Scioto County, but traffic violations, all of these things keep going up because of the problem. We've had the record of being number 10 in the top 10 oxycodone dispensers in the nation, and this is rural Appalachia. And so, and I just want to mention that other problems from a community level, there was no mention of bath salts, right? But bath salts is really, it's crazy. And people are accessing these things and using them without any consideration, and it really makes people crazy in different ways than some of the other drugs. And it's a real problem, but it's cheap. And when you don't have much money, you take what's cheap. And so one of the problems in targeted programs is there's such a broad spectrum of what people are actually taking and using and abusing that it's hard to find targeted programs for every single thing and sort of thinking about things. Heroin is growing. The use of heroin is growing. Again, anything that's cheaper. I sat in a parking lot a while back. I was doing my grocery shopping, and I had this woman come up to my window. You know, she had a flat tire and a sick kid and a story to tell me, and could I give her some money? And I always refuse to give money to people who I know are going to take and use it on drugs. And I watched this woman make her way through the whole parking lot, knocking on every window and talking. And I went in and did my grocery shopping, and I came back out, and there she was, walking out off the parking lot to this nice big Hummer that was parked waiting for her to get her money. And so this is the kind of thing that we see. It's not that it's not visible, it's very visible. But the problems are deep-seated, and the solutions seem to be evading us. Some comments. This is a really busy slide. I don't expect you to read it, but I wanted to particularly look at the idea that we have third and fourth generation drug abusers. Now, if you've grown up in a family where this has been a perpetual problem, it's a different situation than if it's a new problem. And if we're looking at developmental differences, you know, we're seeing things, the young people are being exposed to things sooner and more differently than what their parents were, and the neighborhood. I can tell you from my own experience, going back to Portsmouth, Ohio, has been so sad for me, seeing how what was once a beautiful community just decaying before your eyes. And this is a problem of what substance abuse can do. But it's not just substance abuse. It goes back to the disparities of the community, right? If there's no jobs, no work, no income, nothing to do, what do? You got to do something. And what's appealing? And what are your friends doing? And what's the social network saying? So that's a big problem. Let me talk to you a little bit, though, about a couple of other problems and hopefully tie these things together. This map shows the obesity. This is ages 2 and 4 years old, and it's the whole nation. So the darker the blue, the larger the obesity problem. And as you can see in this national map, it's a national problem. It's not just isolated in the Appalachian region. Now, I always wonder where in the world they got these numbers from, right? Because when I talk to people in the Appalachian, they don't know how many kids are obese in their schools, So I'm kind of like, okay. But when I go to Walmart, right? When you go to Appalachia, you go to Walmart because that's where everybody is, right? And so I always go to Walmart so I can check out the real people. And when I walk through Walmart, especially later at night, everybody is obese, all right? And families are obese. And so I would say these numbers that we see on this map are just cautionary and not disclosing how big the problem might really be. And what we do know is that if we don't change anything, by 2058, 50% of people will be overweight 100% will be overweight or obese, and 50% of us will have diabetes. It's a critical concern. And what we're seeing with these young children already is that they have high blood pressure, they're having heart conditions, and they're not out of their teens yet. And that's a concern. So what we're looking at within the next 20 years is this generation that's coming up not living as long as their parents or grandparents. Right? We're going to see some big disparities there in health. Now here's one of the problems. We're really good at sitting in the Appalachian region. All right, so that dark blue corridor that you see there is Appalachia. And you can see we get number one for being the least active people in the nation. Now, this is not the history of Appalachia. Those people who settled in Appalachia were hard workers, right? They had initiative, they had dreams, they had desires, they had intentions, and they built communities, and they worked hard, and they were independent souls with a lot of pride in what they did and proud of their accomplishments. But something happened along the way. And I'm not going to get into all those things that happened, but a number of things have happened. And today, mothers don't let their kids out. They watch the news and see all that stuff that's happening up here in Columbus, and they think that over here in the mountains, that some bad thing might happen if you let your child play outside by himself. And so children are inside. They live in some places where they can, on their own property, be outside and active, but parents are overly protective. There are not really safe places. You can't go walk on the highway unless you want to take your life. You can't ride a bicycle on the street. And in rural places, it's really hard to find ways to get with other people to play, because many people live in places that it costs money to get in a car to go someplace else. And the neighbors might live down the road. Years ago, people walked several miles to school. Didn't have to worry about weight when you walked 2 miles each way to school. But now people drive to the end of their driveway to get the mail, or they wait with their children in a car to get the school bus. Right? So we're encouraging inactivity by what's going on within our families and the social stance we're taking. This map shows the healthiest part of the nation and the least healthy, or if we could combine those together. So move out west, right? If you move to Colorado or out California, you've got a better chance of being much healthier. If we were to look at demographics, we would see a median income, high school graduation, college degrees, all those things would be exceedingly higher than they are in the Appalachian region. But when we look again at this map, we see that if we combine diabetes, obesity, and inadequate physical activity, we're in trouble. Right? We've got some big problems here. Now, you're all thinking, what's this got to do with substance abuse? Well, it's all part of the same picture. Right? Sometimes we want to parcel things out, but these things are all interactive. Right? They're all interactive. So if you're isolated, and your isolation is in your own home, and your family is depressed, substance abusers, unhealthy in their attitudes, how are you going to be? And I think that explains a little bit about why we're seeing third and fourth generation problems in many things. And if you're being exposed mostly to the media through television, what is your picture of the world? And what do you want to be? And remember, these are not necessarily the folks that are on the internet looking at YouTube and listening to TED Talks, all right? This is a different group of people. So if we look at the problem of obesity and the problem of diabetes over time, you can see that as the obesity problem has increased, so has the problem of diabetes. And this is a national concern, of course. However, if we look at Appalachia, about 2 years ago, there was a paper that came out that talks about the diabetes belt. And the diabetes belt pretty well follows the stroke belt. And so you can see that this is an area of the country where we have a significant problem. $18,000 for every hospital admission is about what they're thinking for complications of diabetes. That would be a 2 or 3 day stay. And that's the cost of, I may have that slide on here. I'm going to wait a minute before I give you all that. But here's some of the complications, right? So, and you probably don't recognize, if you're not in a healthcare field particularly or are studying the problem of diabetes, what we know is that most people have the disease 5 to 6 years before they're diagnosed. They're seeing their physician, but the physician says, now you got to quit eating so much, right? Now I want you to watch your diet. Well, they're watching it, but they're still eating it, right? And we want you to get a little more active. Well, you know, what does that mean? I'll get up and get my beer out of the refrigerator rather than asking my son to get it for me. If we don't be specific about what we want and we don't diagnose early enough, then people just think they don't have it. So when do they get diagnosed? After they've had the heart attack, after they've had the stroke. Then they find out they also have diabetes. And this is a major problem, and it's a problem for us as health professionals in thinking it. And because diabetes is what we would call a silent killer, you don't know that the damage is being done early on, you only know it at the end. People don't recognize how critical this problem is. Here's the slide I was looking for. So this is a global problem. About 26 million people in the U.S., 79 million we think have prediabetes. That's like an iceberg, right? So we kind of know a little bit about the tip, but we really have no clue how big it is at the bottom. And nothing is changing, all right, significantly. So the bottom of that iceberg is getting bigger all of the time. And just about a month ago, these new numbers came out that $174 billion is what the nation was spending on diabetes-related incidents. And now we're up to 245, which is a 41% increase in 5 years. Now, what's it going to be in another 5 years, right? We're not stopping the problem, and we're not going to have money in health care, period, if we don't do something about the diabetes problem. I mean, that's really a significant. Everywhere I go, and I work in a lot of different places these days, I always ask about substance abuse. It's not my business, but I just always ask and have that conversation too. And what I'm told is, yes, we have a problem. Everybody in the Appalachian region has a problem. Some are worse than others, but they're correlated problems, and we need to begin to think about how do we look at these things differently. So if we want to prevent type 2 diabetes, there's several things that I think are important to consider. First, it's common. Everybody has diabetes. If I'm in some place and I say, all of you that have diabetes, raise your hand. At least a third, maybe half of the people in the room will raise it. If I ask them, do you have a close family member, everybody in the room raises their hand. So it's a family matter problem. Everybody in their families, they're exposed to it. And when you're exposed to something regularly, you don't pay attention to it. You begin to think it's normal. And I think that might be a little bit about what's happening with the substance abuse, is people are now quantifying this as normal, usual kinds of behavior and not seeing that there's a way out or there's a different choice. They just see that this is what life is, and they're in the midst of it. When people get diagnosed with diabetes, they get handed they get told what the diagnosis is, maybe a little bit of medical jargon about what that means. Their biggest relief is generally if they don't have to take insulin shots. They get handed a few pamphlets and maybe a glucometer to take home with them. Often not even instructed on how to do it. Maybe get told to go to your pharmacist and they'll help you with this. And if you don't have health insurance, or if the hospital has decided to lay off the diabetes educator because it's a good cost-saving mechanism for them, it's not really a system that they make a lot of money on, it becomes a problem because most of the nurses, I teach nursing, and most nurses are not comfortable working with the problem of diabetes. They're not up to date, and it's a major concern. And then on top of this, the general information about the problem of diabetes is lacking in communities. People don't know where to go for help. They counsel each other, and that counsel is, you shouldn't do that. I told you not. Right? It's a really kind of a negative thing, and it's not affirming, and it doesn't give them information that they need. And the information about prevention is not there. they don't know they can prevent the disease, and they don't know how to go about those steps. People are slow to seek medical help. They generally, if you don't have the insurance and you don't have a doctor convenient, you save the money because your son needs a new pair of shoes. And if you have a limited income, you have to make hard choices about the ways you spend your money. And so very often that medical care doesn't really happen until people are really sick, right? So things we might have solved early on are not done because there's no place to go for help, and they're kind of left out of the loop. Family is not very supportive. There's a stigma associated particularly with diabetes. Nobody wants to talk about being fat, and people get defensive about it. We're not very astute in the way we approach the problem. And the other thing that happens as families is, I know you have diabetes, but wouldn't you like a piece of this peach cobbler? I made it specially because you like it, Or we're having our church social, and, it is a mountain of food that we can eat. And then I'm not going to go into that. We have social networks, but unfortunately, there's been a fair amount of research that talks about, we're like the people we hang out with. And so if the people we hang out with are all doing these things, we begin to see things as norms and not recognize that there's a different way we might go. If the environment and policies don't provide opportunity for some other choices, we've got mountains to climb, but there's no entrepreneur trying to sell bicycles and mountain equipment in the communities where I go to. And yet those could be opportunities, but nobody's thinking about that at the present time. So what's right? All right, I don't want you to leave with all negative, because there's a lot of good things about Appalachian people. If I'm going to get a flat tire, I want to get it there, because I'm going to get help quick. And they're going to be nice, and they're not going to expect anything from me, and they're going to be friendly, and I'm going to make a new friend. Right, so there is a sense of neighborliness, caring, consideration. People are very well socially connected. Years ago, when I did my very early research in Appalachia, I would ask a question about who's your neighbor, and they'd say, "Oh, well, everybody's my neighbor." If you live in the county, because we know your family, and you used to work with my ex-brother-in-law and 25 years ago, so there's always these connections. And one of the very strong attributes of the area is that if you want to get something done, community people can mobilize the community to get things done. They're connected. My brother-in-law is the judge, right? My sister is the doctor or the dentist. And so people, it's not, you don't have the social barriers in a rural place that you have in an urban place. People are very much intermingled in their interactions. And I could talk a lot about that. But in Appalachia, there's three things I generally talk about as far as cultural traits, and that would be family, place, and faith. So family is a strength, right? How many of us can go across the street and there's all of our family, or go down a mile and there's our relatives, or talk to our father every night because he's going to call before I go to bed. And so there's this close interaction that occurs in the Appalachian region with many families that you don't see in other places. I hope that one of the things that you're hearing is that many of the traits in the Appalachian rural region are much like what you would find in minority groups if you looked at close families, right? It's very similar, right? Those patterns are very similar. As far as place, there are traditions, and many of these are county kinds of things, but we do things a little different. For instance, if you come down in our area, you're going to see Memorial Day is coming up, and every grave will have some plastic flowers on it, right? And the family will have gone there and taken those, and that's a responsibility, and you better be there to do it. All right, it's part of what, so there's some of these things that one needs to know. Faith, I learned years ago when I worked in hospice care, is that everybody gets religion when they die. And because we're part of the Bible Belt and very fundamental in many people's beliefs, there is a strong sense of faith that comes into play, especially when people are sick or dying, and praying for and those things. And sometimes those things are really helpful and strengthening, but sometimes they can also be barriers in preventing people from getting real help that they might get otherwise. So there's a lot to be said about those things. The important thing that I think that you all need to consider as you're thinking about this region is that place matters. And that if you're committed to living in a place because it's where you're secure, it's where your family are, you love it, you're happy and you're content, you're probably not going to move. And so, unfortunately, there's not a lot of people moving into the area who are bringing new and innovative and different ideas. And we know that wealth and health go together, right? People who are wealthier have better health. In this particular area of the country, you can't walk very easily. There may be some parks. I work in a couple counties over in Kentucky that have some wonderful parks, but you have to drive 20 miles to get to the park, right? And that's $4 of gasoline. And you may not want to spend your money that way, or you might not have the option to spend your money. Social attitudes are really important. What do people in the community think? We can, as professionals, we can think up all of these great ideas. They sound good when we're sitting around in our little groups having conversation. But when you get to the real people, they don't work that way, right? Their attitudes and ideas are often different, and the way they behave and the networks they form are not predicted as what we think they are in the textbook. And there's a great deal of lack of knowledge. And this knowledge is probably national, but I see it particularly in the Appalachian region, is that we have taken home ec out of classes, we've taken physical education demands, what's served as far as the school lunches and nutrition is really not a good example of what is healthy food and healthy eating. There is lack of encouragement for or opportunity to learn about nutrition or diets. And so we have parents who don't know how to cook, right? And lots of processed food, food deserts, lots of other concerns that are there. And all of these things then sort of combine together. Again, I like the ecological model because it's not a single thing. It's this interaction of all of these factors that are some personal, some family, some community-based that are making the difference. And perhaps the way we're parceling things out may not be the solution. So we have mountains of trouble. What are the solutions, right? And I know you want me to tell you those right now. And I wish that I could. But I can tell you a few things. Obviously, the problems are big. Many people have similar problems. Appalachian people have been innovative. I don't know how many of you actually, I didn't ask at the beginning, but I'm looking around and I think maybe some of you might be from the region just because you're nodding heads when I say certain things, so you agree or you know. But Appalachian people are, I call them saving people, right? So many of the older folks went through depression, or their parents or grandparents did. Always been hard times, and so they save everything, right? And some people save it in their yard, and some people save it in their front porch, and some people save it in the house. And if you go into many people's homes, it's very eclectic. You could find a little bit of anything and everything there, right? So, and they have this idea of conserving, right? They're able to take things that other people wouldn't think possible and make something of it. I always, when I'm teaching students, I always ask, when I teach community health, I'm always encouraging them to, as you do this community survey, take a look at the architecture of the Appalachian region. You know, how many porches were built on the weekend by family? How many houses were added on to, you know, when they had the money, right? People own their own houses, they own their own property. They're not up to the scale of what you would see in the fine place I stayed last night, but they're adequate. And people are more than happy with them. So people don't lack motivation. They just have sometimes been pushed down so much that they don't know how to get out of that and change. They need some new stories. They need to have some hope for some different opportunities. And one of the problems that that I see, and I'm going to talk about diabetes, but I think I could probably extrapolate that into other issues and say it's a problem of leadership. And because your family name is known, you're often the person elected to whatever the position is. And people who or might be very capable in the community are intimidated because of the power that lies within certain families and certain names and communities. And the coalitions that are formed often are friendship networks, and whoever is the coolest dude leads the coalition, and everybody says amen. All right, so they're not people who contradict each other. They're not people who confront each other face to face. They're not comfortable sitting in groups and arguing and then going away and still being, like we might do in an academic setting. It's very guarded. And so the skills set that they have is often replicated from the past because there's not a lot of new people coming in and bringing new ideas. And when they do come, they're us, and we have a grant for a year, and we come in with this big to-do, and then we're gone. So there's a lack of trust of who we are in that area, and a sense that these people really don't care, really not committed, they're just out for what they want. Right, so those are some of the real problems I see. This insider-outsider perspective. In this project I'm working in now, my project director asked me about at the end of the second year. She said, well, what's the best thing you've accomplished so far? I'm working in 11 different counties in 4 different states. And I said, all of the coalitions trust me. That is the best thing I've done. It took a whole year or more for them to get familiar with me enough to actually trust me so we could begin to work. So when grants are only, you have a planning grant for a year and then you hope you're going to get something else, it's not long enough. We need that continuous time to really get in there and make some difference in that. Building upon the strengths that come from the community. Right? It's with the people. The people have the answers. They have their own answers, and we might have our evidence-based practices that we say are the best, but they want to modify them, and they want to change them. And if we come in and we say, by golly, this is the way, you're part of a research project, or you have to do it this way, they don't want to. They're not interested. And so we have to learn to work with what people have and move them in directions so that they know why they need to act differently or try to do things differently. Recognizing that change is slow and that making small steps are progress. We sometimes go in and think we're going to create a miracle in a year or 6 months, and that's not going to happen. I have a 5-year project, and I'm hoping at the end some of these people in the community understand what prevention is, right? Have I prevented type 2 diabetes in the communities? No. But if they begin to understand what prevention is and that lifestyle is part of that, that's a big step forward. And it will take me 5 years to really make that difference. So it's a long-term commitment, and it's a commitment from us on our part when we're engaging with these communities. And finding ways to strengthen local leadership. I'll give you an example. I'm getting close on time here. I'm working with coalitions, and so here's the way a rural coalition works. They all come together for a meeting, and they have some money they want to spend. So now they start talking about what they did last year that they liked, right? And what was fun, and who showed up, right? Then they decide how they're going to do that again, right? And that's basically it. All right, so I came in and I said, these are our goals. Well, they never had goals before. They were very unspecific. They were just a diabetes coalition. So the whole idea of having a goal is a beginning point. And then I introduced the idea of logic models. Now, you understand this is the end of the first year. And I got brave enough and I said, okay, you're going to make a logic model. Well, they looked at me like I was crazy. And I thought maybe I was for a while too. But through perseverance with them, this is the 3rd year of the project now, and they're actually talking about logic models and goals. So it's a matter, you build the trust, you get in there for the long term, you move people along slowly, right? And you don't expect the same thing you would when you were a graduate student or what you would expect from others that you might be teaching. So strengthening the local leadership, and it's not like I come in and do a workshop and teach them. It's like I just keep talking to them, right? And then they begin to talk about me when I'm not there. And then hopefully talk to each other about the ideas that we're planting. And as they see results, they have greater confidence of making moves and trying some new things. In diabetes, I talk about people being stuck in the story. And that means that they're telling the same story about diabetes that they've been telling for generations. And unfortunately, the health professionals are often telling the same story too. And so we have to restory that. We have to tell them about prevention. We have to inform them that the ideas about diabetes have changed dramatically in the last 15, 20 years. The way we manage it is different. And the fact that we can prevent it, we know more about that. So giving that information. So what we need is to be in things for the long haul, and not because it's a project, or not because it's a student assignment, or not because it's my dissertation. I mean, there has to be, it may be what gets you there, but you need to at least convey a sense of authenticness and genuineness as you're working with people in this area, so that they begin to understand that you sincerely care about what their needs are, and that you're willing to listen to them. These are my two websites. I welcome you to go if you're interested. I know you're interested mostly in substance abuse, but on the diabetes family one, there is a whole lot of information about Appalachia you can find there. And then the second website is the current project I'm working with, and so you can learn a lot about that.